Hi, my name is Dr. Ipeleng. I am an OBGYN, and in this video, I'm going to be talking about the signs and the symptoms of pregnancy, the do's and the don'ts. And before I go any further, I want to say that many of the signs are not unique to pregnancy. That means that some of them might be an indication that you are about to fall sick or that you are about to start your period. The proof really is in the pregnancy test. I'm going to start off with the most common signs. Missing your period, right? This means if a week or more has passed without the start of your menstrual cycle, that you might be pregnant. And of course, it could be misleading if you're somebody who has irregular periods or if you are under periods of stress, whether it's emotional or physical. Another sign is frequent urination. In pregnancy, the volume of the blood increases. That means the amount of blood that you have in your body increases, and this means the kidneys now process extra fluid which goes into the bladder, and you will see that you need to urinate frequently more than you are used to, and this is very normal. Another sign is the nausea with or without the vomiting. This is what we all know as the morning sickness. It wears off in the second trimester and the third trimester. Another sign that you will have in the first trimester that you might have because some people don't experience all of the signs is constipation. During pregnancy, the hormones cause your digestive system to slow down, and this will lead to constipation. Another sign is bloating, and the bloating you will have is very similar to when you are about to start your period. Another sign is aversion to smells, to certain types of smells. So you will be very sensitive to smells in your first trimester, and some of them you might not like. Another sign is implantation bleeding, which is light spotting, really. It's not supposed to be any kind of severe bleeding. If you are bleeding like that, you need to see your doctor because you might be having a miscarriage. The implantation bleeding happens when the fertilized egg attaches itself to the walls of the uterus. It happens about 10 to 14 days after fertilization, and this is the time that you were supposed to be having your normal period. So instead of your normal menses, you might have light spotting. Another sign that I want to talk about is cramping. Again, just like light spotting or implantation bleeding, it is not supposed to be any kind of serious pain or intense pain, just a little bit of cramping. If you feel too much pain in your lower abdomen, you might want to see your healthcare provider. I'm now gonna go to the do's and the don'ts in the first trimester, and this is very important. We all know that everybody says when you are pregnant, you are now eating for two. But in the first trimester, there is no proof that you need more calories than when you are not pregnant. Of course, when you are in the second trimester and third trimester, you are going to need more calories. But in the first trimester, you should be focusing on the quality of foods instead of the quantity. You want to focus on eating organic foods if you can to avoid ingestion of pesticides. You also want to focus on eating colorful foods. That means the green spinach, the yellow apples, the oranges. And then another thing that you must do is folate. So folic acid is very important. So if you are not taking it before pregnancy, you have to immediately start in the first trimester because it helps in the formation of the neural tube. And the neural tube is formed in the first trimester. The neural tube is the structure from which the brain and the spinal cord develops. So it is very important to take at least 600 micrograms of folic acid per day. Another thing is the prenatal vitamins. So it is encouraged rather or recommended that when you are planning to get pregnant, you should already start with the prenatal vitamins. But if you have not started with them, start immediately when you test positive for pregnancy. And the prenatal vitamins, they contain your calcium, your zinc, your iron, which you need for the formation of red blood cells, rather to form blood, um, and your omega-3 fatty acids, which are needed for the formation of your baby's brain. If you are not on prenatal vitamins, you have to contact your healthcare provider, who will also recommend the kind of the prenatal vitamins that you can buy from the pharmacy. You can buy them with a prescription. I think they're available in every country. And another thing that you should do is stay hydrated. How do you know that you are hydrated? When you are dehydrated, you will have dark yellow urine. But when you are adequately hydrated, your urine will be light yellow to clear. Hydration is very important as it prevents premature birth, and it also fights things such as kidney stones and even urinary tract infections, because the more water you drink, the more your system gets flushed, right? It gets flushed frequently because you go and you urinate and all of that. Another thing that you should do is take rest. It's very important to rest when you're pregnant. 8 hours up to 9 hours of sleep per night, and even naps around lunchtime. When you get break from work, you should take naps because you will be so tired and fatigued in your first trimester. And by the way, that is one of the signs that you will be fatigued because the progesterone goes up in the first trimester, and that is why you will have the fatigue. So you need rest. Another thing that you should do is exercise. If you're already exercising before pregnancy, you can continue with your exercise. If you are not exercising, it is recommended that you start exercising. Of course, nothing intensive, and you must always speak to your doctor as to which kind of exercises can be recommended to you, looking at your health situation. Another thing, get your flu shot. Um, Other people can be infected by flu and be okay, or rather maybe just fall sick a bit if they're not pregnant. But in pregnancy, your immunity goes low. And when your immunity goes lower, you might fall seriously sick with the flu if you catch it. And research also shows that it can lead to premature birth. And stay healthy. Visit your dentist. And another very important thing that you must do if you are on any medication, it is recommended that even before you fall pregnant, you have to see your doctor. And some medications can either be changed or you can be taken off of some medications if that's possible. Because some medications you can take them in pregnancy, other medications are completely prohibited to take in pregnancy. And you should ask for help. As I've already mentioned, rest is important when you are pregnant, especially in the first trimester. Ask for help, whether from your partner or from your friends, so that you don't do all the chores around the house alone and by yourself. And now I'm gonna go on and talk about the don'ts. In pregnancy, do not smoke. So smoking is very dangerous for your unborn baby. It can lead to miscarriages. It can also lead to premature birth. It can also lead to low birth weight if your baby gets born, and a lot of other birth defects. And yeah, so you should stop smoking when you are planning to get pregnant, and always speak to your doctor. They will help you with ways to quit smoking. And another thing that you should not do is drinking alcohol. We all we know that when you are not pregnant, certain amounts of alcohol could be actually beneficial for your health. But when you are pregnant, there is no amount of alcohol that is safe for pregnancy. In the first trimester, alcohol can lead to central nervous system defects and abnormal facial features and abnormal growth. So don't drink alcohol. And there's also no time in pregnancy, even when you are in your second trimester or when you are in your third trimester, there is no time where drinking alcohol is safe in pregnancy. Another important thing is do not eat raw meat or raw eggs. The meat and the eggs that you eat during pregnancy should be fully cooked, because if not, you are risking contracting diseases such as listeriosis and toxoplasmosis. There could be these parasites in meat or in raw eggs, such as Toxoplasma gondii, which causes toxoplasmosis, or Listeria monocytogenes, which causes listeriosis. So make sure that your meat and your eggs are well cooked. Do not visit the sauna. There's a risk of overheating, dehydration, and fainting in the sauna. So definitely make sure that you do not go to the sauna in your first trimester. Another thing that you should not do is drink too much caffeine, because the caffeine can cross the placenta and affect the heart rate of your baby. Some people say 2 cups is enough per day, but some suggest that really there's an increased risk of miscarriage when you drink coffee during pregnancy. Do not clean the litter box. Although I'm not saying you should stay away from your cats, from your pets, it is important that during the first trimester or during pregnancy, you don't clean the litter box. There is just so many parasites, like millions of parasites in feline waste, and one of them is Toxoplasma gondii, which causes toxoplasmosis, as I have mentioned, and it can lead to miscarriage or even stillbirth. And babies born with this parasite that we find in feline waste, in cat waste, could develop serious health problems. And this includes seizures and heavy mental disabilities and vision problems. Don't overeat. I think I've already mentioned this one when I spoke about the do's. Eating healthy and eating colorful foods. Make sure to not overeat, because actually research shows that about half of people in pregnancy, they end up having an increased weight more than they actually should. And when you overeat, you are risking your baby later on in life having increased risk of obesity and all the other diseases that are associated with obesity, such as diabetes, such as hypertension, cardiovascular issues. In summary, just take care of yourself. This can sound like a lot of do's and don'ts, but the summary really is to just take care of yourself. Make sure that you rest. Make sure that the medications that you are on are safe. Yeah, and all the best with your pregnancy from now going forth.